CHAS is such a wonderful imprint in the community. And I don't just mean that because I love CHAS and I've been here forever, but whenever I go anywhere and I tell people I work at CHAS, or if they ask, their head always tilts and they're like, I love CHAS. And they have some storyline about a situation they were in and they couldn't solve the problem, you know, and CHAS was there to help when no one else was. And I really think that the contribution to the community for CHAS is one of its most outstanding qualities.
As an organization, we have so many tools as a pharmacist that you wouldn't have at an outside pharmacy. We have access to patient charts. We have a collaborative practice that allows for us to prescribe or refill prescriptions. Through our systems, we have the ability to directly communicate with doctors, and that can be very useful because we're able to answer patients' questions, we're able to move patients along their healthcare journey quicker than just relying on somebody else to do that.
So what I think sets CHAS apart is the vast amount of resources that we have available to the providers and the patients at each location. Between the primary care providers, the clinical pharmacy team, behavioral health, MAs, RNs, phlebotomists, and then we have patient resource coordinators to help interact with just the pharmacy team to make sure the patients get what they need at an affordable price, have those questions answered for them in a timely manner. Those things are huge.
In specialty, we do new patient counseling. So when we get a new medication, we call the patient, do counseling on the medication. But that also, there's some questions that we ask to see if there's any barriers to care. Do you have access to fresh water and electricity? A lot of the specialty medications are refrigerated. So if they do not have electricity, that is an issue. So that can either be changed by seeing if they need housing assistance, or if we need to change to oral medication if possible that doesn't need to be refrigerated. So just things like that just comes up as we have these new patient intakes, reassessments. We also call the patient with each refill. So if anything happens in the meantime, they can always bring that up with the technician at the time, and we can try and see if CHAS can help them.
Working at CHAS, there's just always a positive atmosphere. I come to work not stressed, I leave work not stressed. We have the opportunity to help people in ways that aren't really accessible in at least other retail pharmacies or other clinics, other places. That's the most rewarding for me, is just the ability to help people.
As a pharmacist, we have such a strong voice, it's innovative here, and patient care is top-notch. And we're able to do that for everyone.
They truly care about their employees. They make sure that we have good benefits. They make sure that we're paid, you know, on par with industry standards, which I can appreciate. And they do that annually. They're always looking at making sure that we're competitive with other companies. CHAS does a lot of fun stuff for us too. I've never met a group of people that cared more about their employees than I've met with CHAS.